Okay, so let's take a look at the structure of the kidney. Remember the kidney has a capsule of collagen fibers, mainly collagen fibers, going around it. The outer part of the kidney is referred to as the cortex, and that's where the renal corpuscle is. So filtration will be taking place in the renal corpuscle in the cortex. And then you have the inner medulla, which is arranged into pyramids. And then these pyramids, the tips of them, are referred to as papillae. So you have the renal pyramids in the medulla, and then you have the papillae, which are the tips that are going to lead into the minor calyces. So minor calyx. And then minor calyces will fuse to form major calyx, and then major calyces will fuse to form the renal pelvis. And then urine will travel out of the ureter from the renal pelvis. And then here you can see the renal artery and vein as well. So then when we go in and look a little more zoomed up, you see once again you have cortex and medulla, and this would be looking at basically looking at one renal pyramid, so one lobe of the kidney, one renal lobe. And so you have on this side, you have a cortical nephron. Over here you have the juxtamedullary nephron, and then in the middle here you have the collecting duct. So right there you have renal corpuscle that is going to make filtrate, and then you have the proximal convoluted tubule where most of the reabsorption is going to occur. And then you have the descending limb of the loop of Henle and the ascending limb of the loop of Henle. So remember, we are going to reabsorb water going down the descending limb, and then we'll reabsorb solute as we go up the ascending limb, and then we get into the distal convoluted tubule, which will have some absorption and secretion going on, and then the collecting duct, where we will concentrate the urine. So look at it again over here on the juxtamedullary nephron. Remember, there are only about 15 to 20% of the nephrons are juxtamedullary, and these play a role in concentrating the urine. So renal corpuscle going to lead to the proximal convoluted tubule, descending limb of the loop of Henle, ascending limb of the loop of Henle, distal convoluted tubule to the collecting duct. Let's see, then we go over here, and now we're looking at a renal corpuscle. So this is the renal corpuscle, so the capsule it's in is referred to as Bowman's capsule, and then you have the glomerulus, the capillary inside of it, known as the glomerulus. And so you can see here you have the foot-like processes, the pedicels of the podocytes, and then you have the capillaries with the fenestrated capillaries. So this is our filtration membrane. The glomerulus right here. Then we have the juxtaglomerular apparatus, which is made up of part of the afferent arteriole and the distal convoluted tubule. So this will increase our blood pressure. We'll release renin to increase the blood pressure. But afferent arteriole leads into the glomerulus. The efferent arteriole leads out of the glomerulus. So, just to stress, when we're looking at Bowman's capsule, the outer layer, the capsular epithelium, and then you have the visceral epithelium of the capsule that is actually, got these podocytes with these foot-like processes on them that are very closely associated with the capillary. So we push, fluid, through the fenestrated capillaries, through the slits in the visceral epithelium of Bowman's capsule, and that's how we push the stuff out to make filtrate. This is just part of the renal tubule leading towards the proximal convoluted tubule.